as a few health concerns that's sufficing and going on. This is something that has been going on for the longest time, but for whatever reason it is, it looks like it's spiking an increase in concern again in the healthcare field. This is something related to cannabis use, and it's called Cannabinoid Hyperemesis syndrome, CHS. So someone asks, what is all this big name about? Use it on a daily basis for the longest time. They start to experience this repetitive vomiting, increase in nausea, weight loss. So you're gonna see a trend in that. Now this is very serious though. It's just not the normal vomit that you vomit. We're talking about anywhere up to 20 vomits in a day. It is pretty intense, crazy. You really need to pay attention to these things if you're a cannabis user, because this ain't gonna go. Still do not know all the side effects to cannabis use. So if you're using this, it's to your expense. Now, regardless of the many benefits recreational marijuana is imposing on the health of other people, there's a lot of side effects associated with this that some of it we still don't even know. And there's still more research underway to figure out all these things. But my only concern here is because this CHS is really creeping up again. It's becoming more and more serious. People are dying from it. People are really going through crazy life. What are some of the symptoms, signs and symptoms that you're gonna see? So increased nausea, vomiting, intense, crazy vomit, anywhere, like I said, up to 20 times, if not more in a day. Significant weight loss, because why? When you vomit, you're losing water, you're losing electrolytes. It's gonna lead to you decreasing in weight, electrolyte imbalances, you're gonna get dehydrated. So the best thing you could do, I know you're not gonna feel like you want to eat or drink, but you really need to be keeping yourself hydrated, because if you don't, all these things, when they spike up, they come together, it's going to lead to kidney failure. It can even sometimes lead to shock, dehydration, like as I mentioned, electrolyte imbalances. All these are not helpful for the body. So you just need to keep yourself hydrated. The other best way for you to help yourself is also to visit the doctors. So someone will ask, when do I call the doctor? Immediately when you feel like this thing is going on a day or two, that out of nowhere you're vomiting. I mean, if you're a cannabis user and you're vomiting intensively, you need to call your primary care provider. You need to go to the nearest emergency. You need to go to the nearest urgent clinic that is closest to you, you know. Explain yourself to them. But my point is, when you get there, please be detailed about what you do, what you use, because all these signs and symptoms are very vague. We don't know. Abdominal pain is vague. It can happen to, there's so many diseases that are associated with abdominal pain, especially if it has to do with the GI. Okay, so abdominal pain is nothing. They would want to know more. Abdominal pain, what do you do? What do you use? What do you eat? Are you pooping? Are you urinating? Are you, all the necessary questions they're going to ask, they would want to know. And now if it's still more in depth and they can really find out what's going on, they're going to ask you, do you use drugs? Do you drink alcohol? Because they really want to get to the bottom of this. So you want to be kind to yourself to answer these questions appropriately, so there could be appropriate measures of treatment to help you. Okay, so it's just an awareness. This thing has been there for some time, for some years actually, but for whatever crazy thing it is, it's really creeping up. It's really spiking. The ERs, the urgent clinic, are seeing more and more of people coming in with this kind of syndrome. It can be very dangerous. It is very scary, because the way you're going to be puking is so many times, it can be uncomfortable to step out, but you need to step up your game and then find treatment. How can you stop this? The only way for this cannabinoid hyperemesis syndrome to go away is for you to stop cannabis use. People have reasons of why they use cannabis. So talk to your healthcare provider, talk to your healthcare team, let them know, come together, figure out what's going on. You can improve yourself. But the only true way that has come out through research to know the use of marijuana. This is your beautiful girl, Abena Priscy. Like, share, comment, follow us on our YouTube page at Time with Abena Priscy.